Hi, I'm Mark from Fitology Podiatry Centre here in Victoria Point. What I want to run through today is a strapping technique that we use in the clinic for our patients that have heel pain or other types of pain as well, anything where the arch might be collapsing a little bit or causing some issues. So what we need to do this strapping tape is some strapping tape. So we've got two different widths here. We've got 25mm 1-inch tape and we've got 38mm 1.5-inch tape. This is a rigid strapping tape, so when we pull it there's no flex. It's not like your rock tapes or kinesio tapes that have that little bit of stretch in it. Okay, so I want to use this nice rigid tape. It's going to hold that foot firmly while the wearer gets that support. So to do this strapping, we're going to need to prep our tape. So we're going to just kind of measure. So I'm going to measure from the outside of the little toe just around to the big toe joint there, and we want 2 straps that length. You'll notice that as I'm doing this, I'm actually holding the tape to the foot backwards. It just allows you to get in there and measure directly without getting the tape caught up. I'm tearing, you might find at home it's a little bit easier to do with some scissors. Okay, so we've got 2 straps that length, so from outside of the little toe to outside of the big toe. Now we want to come through and we're going to do a few more straps that are coming across the foot. Okay, so for someone with this size foot, Josh's size foot, we're going to need about 4 or 5 straps. So we're just going to get in. You caught that there. You're going to get in and pre-tear some of those. Now, when you're wearing tape, you always have to be a little bit careful. Some people can have an allergy to tape, so if you have an allergy to Band-Aids or something like that, you really need to be careful with the type of tape that you choose. This tape here is just an ordinary strapping tape. You can get a latex-free one, so if you are a little bit more sensitive, that latex-free tape can work better and less likely to have issues. We sell that latex-free tape here, so if you need something, come and see us. Let's get this tape on. So the first thing for this particular technique is making sure that the foot is in a nice, relaxed position. Okay, we don't want that foot being pulled up or anything that's going to change that shape of the arch. Starting with the tape back to front again, and what I'm going to do, I'm just going to lay the tape down the side of the foot so we're coming up to that little toe joint. I'm not pulling or anything there, I'm really just laying the tape down. I'm coming around the back of the heel, and now I am pulling just gently up towards the little toe and anchoring that down. So just making sure Josh is nice and relaxed. That tape is just a touch too long, so I'm just going to use the scissors just to take that little bit off very carefully. Okay, so that's our first piece of tape, and this one's going to help lock that heel in place when Josh comes and stands up and starts walking. Now, next tape, okay, is going to also give us a bit of arch support. We're going to start on the outside of the heel. You can see we're under the ankle bone, just a little bit in front of it. It wraps around, and I'm going to pull just gently. If we pull too hard, we'll cause the foot to crease, which we don't want. So I'm going to take that off. We're just pulling gently, and as we get to the arch area here, we can pull a little bit more firmly and anchor that down. And again, I've gone just a touch too long with the tape, so we're going to trim that off. There we go. And now we repeat. Okay, so the second strap, we're starting on the edge of the foot. We're going to just get a little bit of fresh skin there. So just a little bit of overlap, wrapping around, and this time it's coming up underneath the 4th toe. So we're overlapping by about half, and that nice little bit of pressure. And now we're just going to finish off the strapping by working our way forward. So we've just got a slight little overlap with the piece of tape before. We're not having to pull so much up on the inside this time. And we're going to repeat with the last few pieces of tape. We need just one more there to tidy it up. You have to stand up on Josh and tell a podiatry student we can't show your face on TV. That's probably lost me as well. Did you ever see that? I think we can cut the volume out there. But... So there you go. We got that all finished. The last piece. So it's nice and tidy there. So what we're going to do now is get Josh to come and stand on that and just see how that fits. And when we stand up, sometimes the tape might just lift a little bit from the edges, so we just need to fix that up. So we'll get you to come and jump up. So how's that feeling there, Josh? Is that nice and supportive?
Yep, that's great.
Brilliant, excellent. So the final things to remember here is that if you get itchy or irritable, tape it off. If the tape is causing any more discomfort, remove it as well. Don't put up with it if it's causing you any pain, but it should be offloading those tissues underneath the foot and helping to take away some of your heel pain. And remember, always, if you are having pain, seek attention or seek medical advice for it. Here in Victoria Point, we deal with heel pain all the time. It's a big thing that we do as podiatrists and aim to get our patients great results. We have quite a few different treatment regimes to do that. So until next time, see you later.